I'm terrified. I don't know how you want to start this off, honey.
I mean, I guess that was good enough, right?
Yeah. But see, it's not like a terrified where I'm like, oh shit, I'm gonna die, you know? It's like a terrified, like...
Well, I hope you wouldn't die.
No, I don't, no, it's... She explained, I asked her this question. This was my number one question that I asked her when I went for my pre-op, is I asked, can I die from getting this surgery? Because if I could, I'd still get it, but whatever. But I asked her if I could die, and she said, and I quote, oh no, we're just touching the surface. We're not going in your chest. So I'm not worried about that per se. I'm more so worried about, I guess everything. Everything else besides dying.
So regardless of what she said to
and I'm
you
not worried about dying.
About dying, you're still nervous.
I'm nervous because, one, I'm afraid to get knocked out. I'm not afraid to get knocked out. I'm afraid to not stay knocked out while I'm under and getting surgery. Because I've watched horror stories, which I should have never clicked on YouTube. Screw you, YouTube.
Well, you have to be in it wholeheartedly, because if you...
I'm in it. I want to do it. And if I could do it without going through the procedure, shit, I would do that.
Well, I would have to say about you and every single
person,
trans
yes.
man would agree with you on that one.
I'm excited for after, when I wake up and, you know, the anesthesia and all that stuff wears off. Anesthesia makes me dizzy half the time. The last time I got my wisdom teeth pulled, I woke up crying, and I was kind of dizzy, and I remember feeling dizzy, but I was just so out of it that I couldn't do anything. So once the medicine wears off and, like, you know, I can take the pain pills and feel better that way and smoke a little weed and feel better that way, I'll be fine. I just don't like not being in control of my body, which I guess top surgery for a week, I'm not going to be in control at all of my body because I'm going to have to rely on you, your pretty little chrome dome self. I'm going to have to rely on you to do everything for me and wipe my ass and pull my pants up and make me food, which is going to be really weird for me because I take care of her, so now she's taking care of me.
Okay,
that sounds
clarification
bad.
here.
That sounds bad.
I do not just sit there and do nothing like he's claiming.
I'm not claiming.
I do cook. I do clean. The only thing I don't do is the laundry, okay? So just wanted to make that clear.
I meant take care of as in, like, you know, I'll refill her drink, I'll do things that she asked me to do without questioning it. Not that she doesn't do that for me, but that's usually the role that I take, you know? That's the type of role that that's the type of role I choose to take. So not being able to, you know, help myself, I guess, for a week is going to be really weird. I will be fine. I'll be super stoked. I'll probably wake up smiling after the crying process is done.
Do you want to know something?
What?
You've been non-stop blabbering for 8 minutes and 45 seconds now.
I usually shut up all the time, but I can't.
I know. That's how I know you're anxious, is because you won't stop talking.
I could literally sit here all night and talk all night, but
I know you can, however, I would like to put in a few words too, sweetheart.
Oh, go ahead. What are your words? Take a bite of my burger since I should probably eat.
You really do need to eat. I know I'm not going to be able to sleep tonight.
You will.
No, I won't, because I already have a problem sleeping. That's the thing. I don't know. I always have anxiety, like, all the time, and it usually peaks right when I'm about to go to sleep because I'm just sitting there and I'm doing nothing, and even throughout the day, if I'm, like, at work and it's not busy, I'm sitting there and I'm not doing anything, I get in my head and I start thinking and then I get anxious. So the fact that this is happening tomorrow...
That shit came so fast.
Terrifies the absolute living shit out of me. And also gives me really bad anxiety. I'm not doubting the skills of the surgeon at all. Because I sure as shit didn't go to school for, you know, plastic surgery or reconstructive surgery. And, you know, she did. However, I'm just scared because he hasn't had any major surgeries and neither have I. I don't know what that's like.
You'd want to watch that?
I would rather watch and see what's going on because then I know what's going on as opposed to sitting in a waiting room staring at a few white walls waiting just to see what happens. You know, like I like to know what's going on. I like to know anything and everything. And if I don't, then I get in my head and I think, okay, well, they haven't come out yet. we're fucked. You know, it's like, that's what I think. Like, that's immediately what I go to. And it's not because I'm not optimistic or I'm not hopeful for a good outcome or I don't believe that a good outcome is going to occur, but because I know it would mentally fuck me up so bad if something bad happened that I just kind of make myself think about it anyway, because like in hopes that it helps if something does go wrong, in hopes that it doesn't make it as bad if it does happen, you know? And I don't think anything bad's gonna happen, but I'm telling myself, you know, it's a possibility, it could happen, might as well be prepared for it, you know? Because I was very unprepared and ill-informed when my tongue split happened to me, and yeah, you're going to a surgeon, whatever, I don't give a shit. Like, I want to be prepared for both the good and the bad, and everything in between. I don't want to just be like, nothing bad's gonna happen, and then I'm sitting there, you know, like, you know, 2 hours comes by, and I'm like, oh, I should see him in 10 minutes, and then it's been 45 minutes, I'm like, where the hell's my husband? And then come to think of it, like, I start thinking, like, doctors are ripping, like, bandages out of him, and they're like, fuck, what's going on? Like, there's so much bleeding.
Grey's Anatomy shit.
Yes, like, that's what I think of. I think of, like, movie, someone's dying type thing, you know? Like, someone is massively bleeding out, and they're just pulling rags out because it's soaking up the bleeding and all that stuff. Like,
remember, surface, not a lot of blood.
I get that.
I know, you're thinking
but
of the
that's where
worst.
my mind goes. And I'm not trying to scare you, and I'm not trying to sound pessimistic. Like, I'm not. I'm very excited for him. I'm very happy for him, but it just, if anything were to ever happen to him, I would die. And I don't want anything bad to happen to him because he is my life, and I love him.
That's why we gonna
and
be
I'm
good.
I'm literally about to cry right now.
That's why we gonna be good, baby.
Fingertips. E.T. Phone home. Anyways, I'm gonna be 10 times worse off tomorrow when you guys see me and I wake up and I'm in, you know, the surgical room. And I mean, you guys won't see me in the surgery. You know what I mean. Pre-surgery when I get all my gown on and my IVs and all that. You'll see me then.
Cute. That'll be a look.
Yeah, right. Sitting there, my boxers, fucking titties out. You guys won't see that. Sorry, nobody gets to see that but her. But yeah, that's my thoughts. I'm sorry it's so long. I mean, clearly we're both nervous. But watch us be here in, well, probably like 5 minutes for you in this video, maybe 10. And in 10 minutes maybe from now, you will see me and I'll be sitting here with anesthesia, high as fuck, and happy. But yeah, don't get it twisted. I am very excited for my surgery. I have outside forces that are making me nervous and things in the back of my mind that I know has no correlation, but I still can't help it. And yeah, thank you for watching. So long. Okay, I guess I'm just going to stay on the floor and film this. So, today is the day of surgery, and as I told you guys yesterday, I was going to talk to you about my feelings today as opposed to yesterday, because yesterday I was flipping out. Today, I don't know, I think I'm a little more excited than I was yesterday, only because it's like the day of, and I really thought about it, and I mean, I'm just going to get knocked out, and then I'll wake up, and it'll be as if I didn't even get knocked out. It'll probably be like a split second. I won't dream. I'll probably wake up in a lot of pain, but I'm actually excited now. And I'm like, yeah, let's do this. It's a time. So, that's my feelings now. I'm very excited, very anxious, very eager, and I'm showered. And I feel good. That's what I'm most excited for, is the fact that I'm showered. Because, yep, look at me, I'm nice and clean. I took a picture
Oh, those socks, boy.
PB&J.
Oh.
Yeah, I took a picture yesterday of me standing in front of this mirror with my breast, and I'll probably take one more, just like of a full body, because, you know, I am kind of parting ways with a part of me that I've had for 23 years of my life. So it is kind of like a bittersweet moment. I mean, I hate my breasts. I don't like them on me personally, but I love boobies. But, I don't know. It's like I'm losing a part of me in a way.
My boobies.
Yes. It's like I'm losing a part of me in a way, but at the same time, I'm gaining myself. So, yeah, I don't know. It's bittersweet. It's hard to explain, but, yeah, I'm excited. How are you feeling, babe?
I don't know. I'm kind of dreading it, to be honest.
Why?
Cause
Now she's more nervous than I am.
No, I'm so tired, and I mean, I'm hungry too, so maybe once I get some food in me, I should be okay.
Once you get
but
some food, watch some YouTube videos, time will pass by fast. You'll be like, oh shit, they're done.
I'm glowing today, honey.
Oh my god. Look at her. Look at her chrome dome all nice and washed with shampoo and conditioner and perfect. My perfect princess. My little right hand woman for the next week or two.
Ooh. Oh, who's that sexy bitch in the mirror behind you? Me!
You're really zooming in on yourself right now.
Yeah!
You motherfucker. But yeah, we're gonna go get her continental breakfast at our hotel right now, and then we're gonna head over to the hospital. Stop zooming in on yourself. We're gonna head over to the hospital and check in, do all that stuff, get in my gown, have them draw on my breasts. And yeah, I don't really know what the day holds for me, but I guess you guys will see.
I guess we'll see.
You'll see.
You don't know me.
I couldn't even zoom in. You booked it so fast. Take two, come back. And stay. Freeze for like 2 seconds.
You don't know me.
Perfect. Yep, that's us. Woo!
So, I guess they took him back to get him robed or something. I have no idea. They didn't tell me anything. They just said, go sit in the waiting room. We're gonna take him back. I'm like, take him back to what? Like, I just want to know what's happening to my husband. But we came in, we parked, we got checked in, and then we waited a little bit. Then we got checked into outpatient surgery, and then we waited again, and then they called us back, and then that's when they told me that I need to go sit in the waiting room. Which is basically that over there. But I don't know. There's a lot of weird people around, but I'm freaking sitting by myself. I just want to know like what my husband's doing. Like he doesn't even know what he's doing either. Like he came back out to drop something off because he was like holding too many things. And he's like, I was like, what are they doing to you? And he's like, I don't know. And I was like, I fucking know. So I'm like really stressed out. Hospitals make me anxious. I don't fucking like hospitals. And I don't care if I'm the one that's getting treated or if he's the one that's getting treated. Like I don't like the fact that he's in the hospital. I don't like the fact that I'm in the hospital. I just don't fucking like hospitals. But I guess I'm just gonna sit here and wait. And then maybe when I get back in the room with him while he's waiting to get taken to surgery, we'll film a little more. Hey.
Hey, we gotta make it quick because I don't know when they're coming back. Hi, guys.
I don't know when they're coming back either, but
Look at me. I'm in a hospital gown and have an IV in my arm. I have my tape on my piercings.
I know.
That's so. This was what felt weird.
That's
I was
a
like,
look.
yeah, right.
That's a look.
I look
Oh,
good.
look at your cute little buttholes.
I know they're really dry, actually.
Yeah, they are.
But yeah, I'm already surprisingly. I'm not as nervous as I thought I was gonna be. I mean, I'm still nervous.
Look at you surprising yourself.
I know, right? Yesterday I was like, I'm gonna be so nervous. I'm not that nervous. I'm actually pretty calm.
And you're just in the outpatient surgery room. This is our little room.
Yeah, but I guess they're gonna go take me to meet with the anesthesiologist.
What
They're
a
gonna-
long boy.
Oh, thanks, I'm tall. 5'3", holla. 5'4", actually. No, I'm not.
No, you're
But they're gonna go take me to meet the anesthesiologist next door. Probably give me some medicine to relax, and then it's currently 11:50, so in about 40 minutes, I'll be asleep for about 3 hours, and I'll wake up and be like, whoa, no titties.
Oh, no titties.
And that's gonna be it. And then
I
I'm gonna
can't
be
wait
done.
to see what happens when you wake
I'm
up from
s-
anesthesia. I'm kind of excited.
I'm not
Like, I've
gonna
never seen
remember.
you like that before, you
I'm not
know?
gonna remember anything.
No?
No. But luckily it's gonna be on camera, so that's gonna be great.
It's gonna be so
I'll be
great.
like, what did I say?
Hopefully you say something funny.
I'll probably just keep telling you you're pretty and I love you.
Really?
Yeah, probably. I don't know. I
You're
guess
so
we'll find
pretty.
out. Oh, you're so cute, Chrome Dome.
Shut up, mop top.
I'm mopped up. My hair is really screwed up. But yeah,
This is my baby.
we're doing it.
We are doing it. I can't hold. Wow, where are we going?
I'm excited. But yeah, we're doing it. It's like I'm taking pictures all smiling and shit. I'm not even under any medication.
And I
No,
pee.
you're just.
Yeah, I am. I'm completely butt-ass naked under these clothes. I shit you not.
I know. I saw your butt.
Give me a warm blanket. Tell me to take all my clothes off.
I have a blanket for you in the car and a pillow.
Yeah, I'm doing good, guys. Hello.
Cute.
I'm excited.
It's a look.
It's a bug. No, but I did find out they're not giving me laughing gas. I don't know if I said that yesterday, but I don't like the laughing gas that they give me. But they're not giving me laughing gas. They're just gonna put some stuff in my IV and I'll just go to sleep.
Alright. So I was really stressed out because I'm not really good at talking to people or meeting people or anything like that, really. I'm really weird and awkward and silent, and I just kind of look at people and go like that. So when I initially met the doctors, I was like, I don't know who you are, I don't trust you, you know. And now, after like actually being able to like talk to them and stuff like that, I definitely feel a lot better. But I'm not really good at coping with things like this. Like, you know, I came here with my husband, and now my husband's not here, and I know exactly where he is, so I just don't think about it. And after they took him away, I said, I mean, I guess you could call it a prayer, but it really wasn't. I wasn't praying to anybody. I was just saying, like, I hope he comes out and he's fine and he's happy and he's healthy and, you know, it's everything that he ever, you know, dreamed of. And then I stopped thinking about it. I went to the cafeteria. I'm eating the absolutely most bland chicken pad thai I've ever had in my life. It's alright. I think the only thing that's really saving it is the fact that he put garlic in there. But let's turn into like a mukbang or something like that. I don't know. But I'm just waiting. The person who's actually doing the surgery, her name is Dr. Baker, Dr. Regina Baker at the USC Verdugo Hills Hospital in Glendale, California, USA. So she's really cool, and I definitely trust her abilities, but I'm trying to scarf this food down my face so that I can go across the street, fill his prescriptions, and then come back and be here when he wakes up. They took him back at around 12:45. Right before then, they gave him a transdermal like nausea patch that's gonna last for 3 days because the anesthesia kind of makes him a little nauseous, and the pain medications will also make him nauseous because they're narcotics. That's what happens. But in his IV, he got happy juice, which is basically just something that relaxes you, so you're not like tripping or anything like that or having like really bad anxiety. Within 3 seconds of that, he was like so gone. It was so funny. It kind of scared me a little bit because I've never seen him like that before, but I tried to keep a light heart, and it was kind of funny. And then he's like, can I have a kiss? And the anesthesiologist like, now would probably be a good time to like get a kiss or a hug in right now, because like you're not gonna be able to in a few minutes. And I was like, okay. So I kissed him, and then he like kissed me really hard, and then he looked back and he's like, and then he kissed me again, and then he tried to tongue me, and I was like, you can't do that. So I kissed, and then I pulled away, and I was like, I love you, like be good, like you're like be safe, you know, like I love you. And he's like, I love you too. Like, you're so cute. And then they were rolling him away, I was following them because I had to kind of go out a different way, but we were going the same way at one point. And he looked back at me, he's like, hey, do you want one more boob grab? And I was like, sure, why not? So in front of literally, let's see, there was 4 doctors 4 doctors and then 1 random person who I didn't meet before. I just went up, I grabbed his boob, I shook it, and then I went like that, I pulled away, and then I tapped his face. I was like, be good, buddy. And he's like, yeah. And then all of the doctors were laughing, and I could hear him because I don't think, you can't really control yourself when you have that like relaxing medication. You kind of just say what comes out, you know? It's kind of like almost like being drunk, like your inhibitions are lowered. So as he was getting rolled away down the hallway, which was really echoey, and I was walking towards the waiting room area to get to the elevators to go to the cafeteria, I heard him say, yeah, we have a really interesting dynamic. And I was like, oh my god. Like, it cracks me up, man. But I'm gonna hurry up and shove this down my face so I can go refill his prescription so I can make it to the hospital before he wakes up, because apparently she's done this a million times. It's super easy for her, and she just does it really quickly. So I want to make sure that I am in the hospital before he like wakes up or anything like that. I don't want him to be there. And also I have his glasses, so I kind of have to be there because he won't be able to see anything, and then that'll make him more nauseous. So what the fuck? That was so hot. Ah, I'm hungry. I'm so hungry. I can only imagine how baby feels because he hasn't eaten anything at all today, and both of our stomachs were grumbling and rumbling. Hot. So it's not the worst hospital food I've had. It's actually probably the best, but it is for sure the most bland pad thai I've ever had in the world. So I am going to satiate myself real quick and go to CVS. Oh my god, I'm blinding myself. I'll see you guys. Hi, Bubba.
Hi.
How you feeling?
Good, I just got away with tiredness.
Yeah.
Yeah. Slightly have a headache. I don't want to move my head because I'm in a good position where I'm not dizzy at the current moment.
Sure you don't want your nausea medication?
Yeah, I know. I'm only dizzy because I think I walked up and I don't know. But no, I'm not dizzy like throw up dizzy. I'm just dizzy like I have a headache from the anesthesia still.
Yeah.
The only thing that helps is closing my eyes.
Okay.
But yeah, I'm feeling all right.
Do you mind if I show your chest?
Sure. It's flat.
Yeah, guys, look at that.
Yeah.
It's flat. Don't mind that. That's not blood. I just spilled Jamba Juice all over his bandages.
Yes.
That is probably blood, though.
What?
That's blood, but look at that, guys. It's flat. Look at how cool. Yeah, I'm gonna put this back. Alright, so
Sorry, I'm not saying much.
no, don't worry, baby. So I know that I left off with basically saying, or I was in a car, I'm pretty sure it was the last time that I filmed, but after I went back in and they called me back to go and see him because he was in recovery for about an hour and 45 minutes, and I was just kind of waiting the whole time. I really wanted to see him, but they wouldn't let me because they were just monitoring his vitals and stuff like that. But went in, and I didn't feel like recording, going to go get the prescriptions or anything like that. Like, I didn't feel like you guys needed to really see that. And then I got in the hospital, and it was really just a waiting game, so didn't really feel like you needed to see that either. And then as soon as I got to see him for the first time after surgery, I didn't really want to film or anything like that. Like, I was so wrapped up with trying to make sure that he was okay that I didn't film anything. I told myself that I was going to film, but you just really never know when it comes to things like that. Like, he just woken up from getting surgery. Sorry if you can hear munching in the background. I'm propping you up on the counter and oh, my cat's eating right now. But can you still see me if I'm sitting on the floor? Because it's really uncomfortable sitting like that. So I basically just made sure that he was okay. I fed him some crackers and some water, and I took him to go to the bathroom. I had to wipe for him, and then put him in a wheelchair, pulled out the car, and then drove home. It's really stressful, you know, seeing your person like that. I've never seen him like that before, which is why it was really stressful for me. So, I don't know. I'm really tired. He's really tired. Obviously, he just got surgery today. But he's doing good. He had a few little moments where he was really nauseous and he wanted to kind of throw up a little bit. But he gets dizzy and nauseous from medications pretty fast. He got a prescription for painkillers, a prescription for nausea to help with the nausea from the painkillers, a stool softener to help with the constipation that you're going to get from the painkillers, and then antibiotics that he's going to take to make sure that everything heals properly. So he just took his antibiotics right now. He's waiting to take his pain pills right before bed, and then we're going to take the nausea medication before that too, and then probably the stool softener as well, just in case. We got him a Jamba Juice, and I'm probably going to make him something a little bit more substantial, like eggs or something like that, something quick, because I'm really tired. I'm beat, dude. But yeah, I guess that's it for this video. Make sure that you guys keep watching. We will be posting videos, whenever I can, really, because I don't really want to say on a certain schedule, just because I do have to make sure that he's taken care of, and that is my first priority. I'm sure that you guys understand that. But make sure you keep watching, because we will be posting updates, as the days go on, up until the point he gets his tubes taken out and he gets his chest reveal. So if you guys don't want to miss out on that, make sure you guys turn on post notifications. And if you haven't already, make sure that you subscribe, hit the button down below, and become part of the Robinson family today. And if you like this video, make sure you give it a big thumbs up. It really helps us out a lot. And we'll see you guys in the next one. Bye.